This is Keely King, and this is my sports injuries presentation. I did this on tennis elbow, or also known as lateral epicondylitis. Tennis elbow is essentially an overuse injury. It happens when you get microscopic tears in the tendon. It's caused by repeated gripping and extension of the wrist. This is common in individuals who play racket sports like tennis, badminton, squash, although it can be caused by any activity that requires repeated wrist extension. For an example, like a carpenter that's banging a hammer all the time, or even a butcher. Um, this involves the actual tears generally happen in the common extensor tendon, which is right here. And this attaches to the lateral epicondyle of the humerus. And it affects this muscle here, which is the ECRB. Symptoms are pain that can be felt in the lateral elbow, through the forearm, and into the wrist. With this injury, it can become difficult to hold or grasp things like holding a cup of coffee or turning a doorknob. Symptoms can be acute, but generally it's more common for them to develop over time, where you might just start with like a little soreness or a little ache that gets progressive and worse over time. The treatment for this, sometimes it can heal without intervention if the injury's not too bad. You might just need to take some time off and rest a bit. If that doesn't happen, physical therapy is usually the first course of action. And with this, the physical therapist can teach the patient how to move appropriate to limit the stress. So a lot of times this injury is caused if you're playing tennis, for example, and you're not moving appropriately and you're overstressing the muscle and the tendon. And they physical therapists can also provide exercises to help strengthen the muscles associated with your elbow here. Steroid shots are another option. There's also extracorporeal shockwave therapy. This is where they put a device over the injury and send shockwaves in to promote healing. If the injury is more severe and some of these other interventions don't help, then surgery might be required. There are some home remedies, just kind of your general typical remedies that you would expect from this type of injury. Rest, some over the counter medication like Tylenol or Advil, and ice. For prevention and management, again, it's probably a good idea to work with a physical therapist to help strengthen those muscles and tendons. And they can also help you make sure you're using proper form and the proper equipment during exercise to kind of prevent that overstressing. You could use ice and NSAIDs after activities and just rest as needed. You know, if you feel it getting a little sore, maybe take a couple days off and let it heal. And these are my citations for this. I hope you all enjoyed this presentation. Thanks for watching.